Hello guys, welcome to our channel. So today we will discuss the topic of genital ulcers and their differential diagnosis. So let's start. Genital ulcer can stem from various conditions presenting challenges in diagnosis and treatment. Let's break down the differential diagnosis into two main categories. These are non-infectious and infectious causes. So let's first discuss non-infectious causes. Non-infectious causes are less common but still significant. Here are some key ones to consider. Number 1. Behçet syndrome. Behçet syndrome is a systemic inflammatory disorder causing oral and genital ulcers along with other symptoms like eye inflammations and different other painful conditions. Number 2. Fixed drug eruptions. Reaction to medication leading to recurring skin eruption at the same site upon re-exposure. Sexual trauma, physical injury or trauma to the genital area often seen in the cases of sexual abuse or assault also may cause genital ulcers and is one of a non-infectious agent. Similarly, some vasculitis may also result in genital ulceration like granulomatosis, but these are very rare autoimmune conditions. So these are the non-infectious agents, but these are less common. Now let's focus on some of the important and most common causes of genital ulcer. These are the infectious causes of genital ulcer. So infectious causes are more common and include a range of sexually transmitted infection. Let's explore some of the primary culprits. First, genital herpes, syphilis, lymphogranuloma venereum, granulomainguinale. All of these are different infectious causes of genital ulcers. Some of them are caused by bacteria, some of them are caused by viruses, but other than this, some fungal and other microorganisms can also cause genital ulcers. So, it is crucial to differentiate between these causes through medical history, physical examination, and diagnostic tests such as serological assays, cultures, and biopsies. But now we will focus on the infectious agent and how we can differentiate between these different infectious agents only through history and physical examination through clinical features. So let's see. So guys, look at this diagram. Here some of the most important infectious clinical agents that cause genital ulcers are described and how we can easily diagnose through different clinical features. So first of all, look at the different infectious causes of the genital ulcer, which include chancroid, genital herpes, lymphogranuloma venereum, syphilis, and granulomainguinale. So how we can easily differentiate between these causes of genital ulcers through clinical features. For this, we have the most important clinical features to look for is pain. So we have to look, are these genital ulcers painful or painless? So after this, if the genital ulcers are painful, then we have to look, are they single or multiple? Single genital ulcer which is painful with tender inguinal lymph node is caused by Haemophilus duceri and result in chancroid. But if there are multiple genital ulcers which are painful with tender inguinal lymph nodes, then this is most probably herpes simplex, virus causing genital herpes. So this is the first part. The first clinical feature we have to look for is pain. If the genital ulcers are painful, then we have to look, are they single or multiple? If single, then with inguinal lymph nodes which are also tender, then the most probable diagnosis is chancroid. But if they are multiple in number, then the probable diagnosis is herpes. Now let's focus on the other clinical feature, that is painless. So if we get genital ulcers which are painless, then we have to look for the involvement of the inguinal lymph node. Are the inguinal lymph node involved? and or not. If the inguinal lymph nodes are not involved and there is painless genital ulcer, then the most probable diagnosis is granuloma inguinale. Granuloma inguinale results from Klebsiella granulomatus, which result in a painless genital ulcer without the involvement of the inguinal lymph node. But if there are painless genital ulcer along with the involvement of the inguinal lymph node, then we have to look, are the involved inguinal lymph nodes tender or not tender? That is the second clinical feature. The first one is painless genital ulcer with involvement of inguinal lymph node, but are they painful, tender or not? If tender, then the diagnosis we get is lymphogranuloma venereum caused by chlamydia trachomatis. But if there are painless inguinal lymph node along with the painless genital ulcer, then the most probable diagnosis is syphilis caused by Treponema pallidum. So in this way we can easily diagnose different causes of infectious causes of genital ulcer. So let's summarize. The different infectious causes of genital ulcer are chancroid, genital herpes, lymphogranuloma venereum, syphilis, and granuloma inguinale. And we can easily differentiate on the basis of are they painful genital ulcer or painless, or inguinal lymph node involved or not involved. That's all. Thank you guys.